If there's a lot of people who would want to present themselves to the psychiatric department of a hospital, that would mean that there could be a waiting list. I might come on, let's say, January of 2025 and maybe get the follow-up appointment for a few months later. Welcome to Be Kind to Your Mind, a podcast brought to you by People Psychological Solutions. Here, we bring you the latest mental health news and research while providing you key insights based on our clinical experience. My name is Alvin, and I'm your host today. Many Malaysians are unaware of where to seek for mental health services. Generally, services by mental health professionals could be received via the public health sector or through booking a consultation with a private practitioner. In this episode, we'll explore the different options that potential clients or patients may consider in accessing mental health care in Malaysia. With us here today, in this episode of Be Kind to Your Mind, is Pearl, a clinical psychologist. So let us begin by perhaps offering an introduction of your background and experience to our listeners.
Thank you, Alvin. My name is Pearl, and I'm a clinical psychologist here at People. So I've trained in a couple of different settings, so ranging from university to private settings and also public hospitals. Right now, I am practicing in a private setting here at People, and I work mainly with individuals who struggle with mood disorders, such as depression, anxiety, as well as other ranges of struggles such as anger, low self-esteem, perfectionism, trauma, and also loss.
Okay, so thank you for your introduction. Now, Pearl, you had mentioned that in terms of your training and experience, you have been in different settings, such as being in university, in private settings like at People, as well as in a public hospital setting. And it's very much relevant to our discussion today, where we'd like to really discuss the different options that are available for clients or patients in terms of accessing mental health care. This was also something that was thought of because at times we may feel calls or inquiries that are best suited for different services, such as the public setting. We might advise them to get a referral letter and so on. But I suppose for the general public, they might start off with not knowing where to go. So let's first start off with the most accessible, I suppose, the most available services in Malaysia, which will be the public healthcare setting. And assuming that I am someone who is currently going through some kind of mental health difficulty, or maybe I'm suspecting that my mental health is being impacted at this time, and I'm thinking to get this process started for me to go to the hospital to get the treatment that I need. What are the steps that are required for me to actually do that?
So if you have an idea that you might want a mental health consultation, the first thing that you can do is you can head over to one of the public health clinics, or we call Klinik Kesihatan, near you. So over there, you will first see a general practitioner there. So they will assess your condition, and then if required, they will provide you with a referral letter, which you can use to make an appointment at a public hospital.
Sure. So the first step of actually getting help from a mental health professional in a public hospital will be a referral letter. And Klinik Kesihatan would be community clinics that are managed by the government. And I believe the consultation fees are a few ringgit or perhaps free?
A couple of ringgit, yeah.
Okay, sure. And to my knowledge as well, the referral letter might not only come from Klinik Kesihatan, but could also come from a private clinic. The clinics that you might see in commercial areas, usually with the blue signboard, clinic something,
Yeah.
You could actually meet the doctor and say, I'm feeling depressed, or I've been having panic attacks, whatever the concern might be, and that I'd like a referral letter written to so-and-so hospital. So that is also possible as well, but perhaps in terms of the consultation fees, it will be different, public as well as government.
Yeah, you're right. So I think this is quite common knowledge, but because public healthcare is subsidized by the government, so definitely that would be at a lower rate compared to private clinics. So you would have to weigh between your options in that case.
Yeah.
Yeah.
And usually, and later the discussion will head to the private setting for mental health care. But in general, private practices will likely be much more convenient. For example, you could just walk in and almost immediately get an appointment. In a clinic kesihatan, there might be a queue that you might have to wait for. I believe they might have even numbers that they might distribute depending on the number of patients for the day.
Yeah. So sometimes you might have to reach there earlier as soon as they open in order to get a number. And they also operate based on working days. So Monday to Friday for working hours.
So a little bit of the extra step there in order to obtain the referral letter. And let's say I have received a referral letter to go to XYZ hospital. What would be the next step that I will need to take?
Well, once you've gotten the referral letter, then you would need to head over to a public hospital on a work day and during working hours. So you're advised to reach there as soon as it opens, to speed up that process, avoid longer waiting times. And then when you get there, they will provide you with a date to come back for the next appointment.
So in this case, it would be first a clinic to get a referral letter, followed by heading to the hospital during designated working hours in order to get an appointment, and then another visit to meet for a consultation with the professional.
Yep. So when you get the appointment date, this is typically considered a first visit. So you will be assigned a medical officer that is in charge on that day. So they will give you a form to assess your basic mental health functioning, and then they will do an intake interview with you to assess what are some of the reasons that led you here, and possibly what are some of the service that you need. Yeah, so after that, only you would get assigned to, depending on your needs, either psychiatrists, psychologists, or maybe other healthcare services that are available there.
Okay, so the intake happens during that visit where I would get a follow-up appointment to meet a psychiatrist, psychologist, and so on.
Sorry, the intake happens?
Yeah. So that first visit after I get the referral letter, so that is the time when the medical officer will interview me. Would that be right?
Yes.
Okay, sure. So in this case, then there's going to be a few point of contact before I could get, for example, a prescription or to begin therapy with a mental health professional. And what are the consultation fees that we're looking at here when I do have this appointment at the hospital?
So generally, each consultation costs 30 ringgit. Yeah. So, and for each subsequent one as well, but that's only for the place that I was practicing. So it might be different for different hospitals, but generally that's the range. Another thing is that if you are working in the public sector, for example, you're a government servant, or maybe your child wants to access these services, they're in a government school, then you can get what we call government letter or GL. So this will give you free services.
So it could be, free if I am in a family of perhaps civil servants, or it could cost me 30 ringgit.
Yeah, for each visit.
From my review of the article that people had published on our blog, this was a few years back, which will be updated probably next month or so. In one of the hospitals, there seems to be a difference between referral letter from a public clinic versus a private clinic, where if the referral is from a public clinic, it's 5 ringgit, while private is 30. But I suppose it really depends on the hospital as well.
Yeah.
But nevertheless, 5 ringgit, 30 ringgit, not so big of a difference in terms of the fees. If you would like to compare it to a private setting where per consultation is probably going to set you back a few hundred ringgit, which is something we'll be discussing in a little while. And these fees would also be inclusive of medication, where the person, if prescribed with any pharmacological treatments, could receive those medications as well.
So far, to my knowledge, I'm not that clear on in terms of the charges of medication. Yeah, because I wasn't in charge of the medication side.
Sure.
So mainly for psychotherapy,
Right.
it's 30 ringgit. And if there are assessments required, each assessment tool would cost 30 ringgit. And let's say you were there for a specific issue, that would require a few tools. So I guess amounting up to more than 100 ringgit,
Sure.
but still pretty affordable.
Yeah. So if you think about psychological assessments, and for the audience listening back home, sometimes we might need to administer assessments in the form of psychometric tools, for example, IQ testing, personality testing, if there is a need for that, especially with certain diagnoses where we might need to administer these standardized tests. The cost to administer these tests are actually quite high. In the private setting, it could amount to a few thousand ringgit even, because just acquiring the tools and the materials that are required will set back the center or the provider, 5 digits. And not to mention the fee to pay the consultant. It's very typical that it's going to cost maybe 2,000 or 3,000 for a full psychological assessment. So 100 ringgit is really going to be, a small fraction of the fees that someone will be paying in a private setting.
Yeah, that's right.
The same goes with consultations as well, whether with a psychologist or with a psychiatrist. 30 ringgit versus in a private setting, 200 ringgit, 300 ringgit, some places maybe 400 ringgit. Similarly, it's just a fraction of the price here. I like to point out as well, and this is not a hospital setting, but Mentari is considered a community setting service provider as well. And Mentari is a clinic that offers psychiatric services, in some places psychological or perhaps counseling services as well. We have tried giving Mentari clinics a call, but I think the issue is accessibility. We've been trying to give these clinics a call, and most of them go unanswered. But the one that did provide us with information where the first visit will be free of charge and second visit will be 5 ringgit. This is inclusive of medication.
Wow, that's very affordable.
Yeah. So I suppose the reason for Mentari clinics is to reduce the burden of the public hospitals, as well as perhaps to provide a little bit more targeted interventions in the form of psychiatric care to the community. But these are, I suppose, the process that is required in order to begin receiving services in a public setting. But perhaps we could talk about the advantages and disadvantages of accessing mental health care here. Starting off with the advantage of a person going to a public hospital for services.
Well, I guess the most glaring advantage would of course be the cost. Like we mentioned, because it's heavily subsidized. So compared to private services, it's definitely a lot more affordable. So let's say you are someone who's very conscious on your cost, then this is a good option. Another thing would be the care that you receive. So because in a hospital, there is what we call multidisciplinary care. So this would include different healthcare providers like the psychiatrists, psychologists, and some even share the access of the let's say, your medical records, just to cross-check if to see there's any relation between some of the symptoms and also medications. So that would help your the specialist to make an informed judgment and tailor the care to that patient. Yeah, so you wouldn't have to run to, let's say, a clinic and then to a hospital to get your medication.
Sure,
Yeah.
sure. So the two advantages here, firstly, will be the cost, where it's very heavily subsidized by the government.
Mm-hmm.
Basically, people pay close to, it's almost free lah. I mean, 5 ringgit versus 0 ringgit.
Yeah.
And the second being that you actually have quite good practitioners and a system set up there. So you have in a hospital setting a variety of different specialists where referrals could be made for different reasons. So if a person presents him or herself, let's say in the psychiatric department, and then upon assessment, this person may have some other physical health complications, then a referral could be made to another specialist as well.
Yeah.
So very convenient and comprehensive in that way. Nevertheless, I suppose there are disadvantages to accessing the public healthcare system, most particularly in terms of psychological or psychiatric care. In your opinion, what are they?
Like you mentioned, there are good resources in public healthcare. Some very experienced practitioners are also currently in public healthcare. However, one of the main disadvantages would be that it's very limited. Yeah, because there's very few practitioners in public healthcare. So in terms of whether you are able to book a slot as soon as possible, that would be delayed, I would say. So just now, as we mentioned, there are quite a few steps before you actually see your psychiatrist or psychologist, counselor, your therapist. Yeah, and then get to build a relationship with them. But even then, your sessions might be very sparse depending on the availability. So sometimes it's not just that they don't have the time to see you, it's also that there are very limited facilities in that hospital itself, right? So if you're one of them that's struggling to get an appointment, just understand that it's not that they don't want to, it's that they really can't. Yeah.
Well, this could potentially apply to other healthcare services as well. This is a matter of supply and demand. So there is X amount of supply, but there could be, for example, more overwhelming demand than what the supply could meet. So in this case, if there is a lot of people who want to present themselves to the psychiatric department of a hospital, that would mean that there could be a waiting list. I might come on, let's say, January of 2025 and maybe get the follow-up appointment for a few months later. And that can be quite typical as well from what I understand.
Yeah, it's quite common to get an appointment a couple of months in advance because there's also not a lot of psychiatric departments in public hospitals. So even different hospitals have different waiting times as well. But I would say a few weeks to a few months is very normal.
Sure. And, perhaps this is a topic of conversation for another time, but as clinical psychologists, clinical psychology is a growing field. And in terms of us getting registered with the KKM, it has been quite a recent development. And similarly, I understand that placements can be quite limited in hospitals because, budget and so on. From your experience, aside from psychiatrists, are there any other mental health professionals in the hospital setting?
Well, there are counselors. There are also psychologists, and other, I guess, related services would be speech therapists or occupational therapists, but that is really very limited and depending on the location that you go to.
because from what I understand as well, and this is for a semi-government hospital where I do have an ex-colleague who is currently there as well. The waiting time to meet a psychologist or a counselor could be way longer. Firstly, due to the lack of personnel, but at the same time, I suppose different than psychiatric care would be psychological therapy is something that is going to be more regular. So with psychotherapy, oftentimes it is going to be on a once per week basis. Short-term therapy might be 8 to 12 sessions. So if I'm booked for a slot on Monday morning to meet a person, quite likely my next 2-3 months will be slotted in for this person already. In a week, probably my schedule could only accommodate to just, 20, 30 clients or patients, and that will be pretty much a week of providing psychotherapy. And because of this cumbersome and time-consuming process, if there are significantly more people who require psychological therapy, they might require to wait a long time. From your experience, do clients or patients usually have to wait a long time to receive psychological therapy?
Typically, that's the case, but sometimes depending on urgency and severity, your request might get bumped up. But that's on a case-by-case basis, I would say. But generally, from what I've seen, a few months to even half a year sometimes is the norm. Because even though they are working tirelessly, skipping lunch breaks and all, there's only so many patients they can see in a Monday to Friday, like a 8 to 5, that slot. Yeah, so having a long waiting time is the norm rather than not.
Sure. So you have highlighted the disadvantages, potential disadvantages, right? So it really depends. Maybe I'm able to get a slot quite quickly. Really depends on whether the cases are being cleared accordingly, depending on the time of the year, maybe. But it's going to be quite typical that there's going to be some waiting time there in order to access services. And that would be the main disadvantage if I were to consider accessing public healthcare.
I guess in addition to that, quite related is also the location in terms, because there's not a lot of psychiatric departments available. So then let's say if you want to get an early appointment, you might have to travel a lot further, from your house. I guess there are some places that do offer online services. So I used to do that when I was practicing, but so far as I know, it's not very common. It's really rare to do that. So you would still have to travel that distance to get a therapy.
So it really depends on where you're living. I mean, hospitals are quite sparse. But I think this particular problem, as we move on to discussing on private mental health services instead, this problem can actually be typical to the private setting too. Because perhaps if we live in Subang, PJ or KL, we might not feel it. But most private service providers will be concentrated in the Klang Valley region. If you're thinking about, for example, the East Coast or East Malaysia, or somewhere that's out of the city of KL, it can actually get quite difficult to locate a service provider as well. That's just how things are at this time.
Yeah.
But so far, I think we have discussed the advantages and disadvantages of the public mental health care setting. Generally, cost is one big consideration. We could definitely save a lot if we were to access public services. But one thing to consider would be the convenience as well as the potential waiting time. And, if we were to move to the private setting instead, I suppose the advantages and disadvantages here are flipped. So on the one hand, one advantage of accessing private services would be that it's super convenient. I could just search up online, or if I'm in the Klang Valley region, as I'm driving around, I could even spot them
Yeah.
around the commercial
Yeah.
lots, and then make an appointment pretty conveniently. If I want an appointment today, most likely I can get an appointment today as well. I probably need to search around, but it is something that is very, very possible.
Yeah.
So convenience is something that the private service providers could provide. And what other advantages do you think private practitioners could provide to potential clients or patients?
Well, the convenience is definitely the main factor. Another thing I would say is your preference in choosing a practitioner or a clinician. Yeah, because with so many options, you can sort of pick a therapist that best suits your needs. So nowadays, with all of the websites around, you can just go online and see if this therapist profile is something that you feel you are drawn to and can develop a relationship with. And yeah, you can just book an appointment based on that. So definitely in our multicultural country, so we do have certain considerations, let's say gender or let's say languages, that kind of thing, where you feel most comfortable expressing yourself in. Yeah.
Convenience, as well as the selection of the therapist. It could be a psychiatrist, a counselor, a clinical psychologist, but all of this information is freely available. I agree with you. A lot of our inquiries may be more comfortable speaking to a male or a female depending on their presenting concerns. Language is a big factor because we are oftentimes better able to express ourselves in our primary language, and different people may have different competencies in terms of their express language.
Yeah.
But I think, I'd like to caution everyone here, for the listeners back home, although it's really important to look at the therapist's background and qualifications and whatnot in order to make a best pick for yourself. Because I think as a potential client or patient, you would like to look for someone who might be most experienced or suitable for your presenting concern. Language and gender aside, if let's say I am depressed or I believe that I am experiencing some kind of trauma that is impacting my quality of life, when I'm looking for a therapist, likely I'm looking for these reasons, these presenting concerns that a particular therapist might be more experienced in order to make the judgment on booking a slot with that person. But I think two important considerations here would be, number one, not everything you read online can be true. As I find that there are increasingly a lot of practitioners who might not be as ethical in, for example, putting up fake reviews that could be misleading to people who might be selecting a therapist. And secondly, as much as a potential client or patient intends to make an informed choice, the choice that they make might not be a best fit for them as well. So maybe the first attempt might not be as successful. I would recommend in that way that they would also want to consider, hey, could I try out an alternative therapist instead? So as much as there's going to be all of the information online, making that best pick that you think is best for you might not be the best one the first time around. And secondly, read everything with a, what do you call it? Pinch of salt. Yeah.
Yeah, I would say it's quite similar to online shopping or even online dating, for example. You see all of the information out there and then you meet them in person and it's a different story, for example, or it's a different product. It's not the same.
Yes.
And then in this case, you as the client has the right to decide, whether this is right for you. Of course, there are many factors into choosing a therapist. I think you covered this in a previous episode as well. Yeah, so you can definitely decide that, you know.
Upon the first point of contact with that person lah.
Mm-hmm.
But actually, this remains an advantage being in the private setting, because we don't have the liberty of choice if we were to present ourselves to a public hospital instead. You'll be assigned a doctor or assigned a psychologist or a counselor. It is not something that I can freely decide, such as when I pick a private practitioner.
I guess that's generally the case.
Mm-hmm.
I do know some patients who have followed doctors from different hospitals. But of course, that would depend on their availability as well as the hospital's policy towards this, picking a doctor and such.
Right. So there can be a chance where the patient could select a doctor in the public setting.
Yes, I would say, but it really depends on the place.
Okay. So it's a case by case basis lah, depending on depending on hospital, depending on the setting. But in private setting, it is definitely a truth. You are the one that's making that decision. You are the consumer, basically, right? You are making a choice in terms of how you're going to be spending your money.
Yeah, I would say, because let's say you find that this isn't working out and you would like to, we're talking about therapy here, switch to a different therapist, try out something, but let's say you are in a public hospital, you find that this medication isn't working for you, like psychiatric medication, and you want to change your meds, but your appointment is a couple of months away. That would be quite tricky to maneuver. Let's say you were in that situation.
Sure. So I think here the issue here is more of flexibility. That in a private setting you have way more flexibility than, let's say, you are to receive treatment in a public hospital.
Yeah.
So we've covered so far. I think the advantages would be that kind of flexibility, and I think the choice, and also the convenience of having a more immediate session. All that is possible in a private setting. But let's move on to the disadvantages instead. I suppose cost will be a big one. And without asking you first, I could already point out that cost is a big factor here. And sometimes we do get inquiries, well-meaning ones. They would like to access the services, but really, as a private setting, a private service provider, our hands are tied. Consultation fees are the only way for us to sustain a business and to ensure that all of our consultants are paid their fair worth. So sometimes, for example, we might get potential inquiries by potential clients who really cannot afford the fees. And so we have to consider that, hey, there's this public healthcare setting that is very subsidized by the government. It is a service for all Malaysians, and it should be utilized also. Everyone will need to play their roles here. But for the audience back home, for your knowledge, consultation fees with a psychologist in a private setting could set you back per session 200 ringgit, maybe up to 400 ringgit. I think there's centers that charge more maybe. But you are thinking about continued services at least for some sessions. So the overall fee might be looking upwards of 1,000, 2,000 ringgit in total. So that's going to be a very big difference compared to paying 30 ringgit per consultation, and maybe throughout the course of your treatment, you're looking at most a few 100 ringgit at most if you are on very long-term treatment.
Which is also scattered, because of the timing,
the
availability. It's scattered over a period of time. But with the flexibility and availability of appointments, so generally, if you have a couple of sessions every month or every other month, that would set you back quite a bit if you wanted to receive like this continuity in your treatment.
And I think to add on to that, before I forget about this, probably a recommendation to clients or patients considering private services for their mental health needs, that they consider the full extent of treatment rather than I, at this point, need to fork out a huge sum relatively to how much maybe savings I have or how much money that I have
Mm.
for this one session, and hoping that it will be a miracle, right? Like it will solve my problems. But in actual fact, we have to consider that when we are committing to a service, we would like to receive the full extent of the service. It's the same with, I suppose, signing up for swimming classes. You want to consider the full cost of when you'll be able to learn how to swim, rather than to consider, oh, I'm forking out so much just for the first lesson, which likely will not amount to too much help in the first place.
I think generally there is still an idea that when I come in, I want to get my problem solved. So some clients, they do come in thinking of it as like a doctor's visit. So I come in, I tell you my problems, and somehow there will be this cure. But typically the process of healing, it's a process. Yeah, it's not like a one-off thing. It's even medication, it takes time to see effect. And then what we're doing in talk therapy, it's more progressive.
Sure.
In that sense.
Yeah. So even with meeting a psychiatrist, as much as you might be prescribed in your first consultation, but there's also the follow-up to examine the outcomes of that prescription, and likely further follow-ups as well. If, for example, there are changes of prescription, and to also monitor progress. There's going to be several sessions involved here, along with the cost of medication. So all in, net costs will be plus minus relatively similar. Because if you think about psychotherapy, you're looking at short-term therapy of about 8 to 12 sessions, assuming that there is an active diagnosis. Maybe the person has a depressive disorder, anxiety disorder, and so on. So that, spans across some sessions where progress is continually made. But first, just coming for the one session, probably not going to be, a cure-all kind of approach. And if costs or fees are a limiting factor, I would recommend that they would access a service that Malaysians should use in the first place, which is the public healthcare setting.
Yeah. I guess depending on your needs, as long as you've considered, and you are getting help, it doesn't matter whether it's public or private, ultimately, because the one that is benefiting from it is you, and you're the one that has to go through with the effort, the time, the money, all of those things.
Yeah.
So it is still your decision.
Yes.
Yeah.
And perhaps there are people who, quite a significant number of clients who might not be as informed with regards to this, and probably that's the reason why we're having these kind of episodes, to disseminate this kind of information and to manage expectations. If clients come in for the first session and they're thinking, hey, this should solve all my problems, that is where we educate them with regards to, what actually works, what doesn't work, what the process looks like, so that they can be better informed, and then they make a decision from there. But nevertheless, when I think about providing services to a client and I'm meeting them face to face, it might mean that I would want to write them a referral to a public hospital instead, because my priority is really for the treatment goals to be met. And if it cannot be met, with, for example, cost being the limitation, or that even cost is not a factor, but you don't wish to commit to the fees in the private setting, the priority for me is that you receive continued treatment so that your mental health concerns can be addressed. So whether or not that might be in the public setting, might be in the private setting, might be with a different kind of therapists altogether, that should be the priority of mental health professionals in terms of thinking whether their service is suitable for their client or patient.
So the patient still has the choice, even ultimately in deciding, but this has to be an open discussion between the provider and the patient or the client themselves, to figure out what's the kind of the best plan that can work for your health moving forward. Yeah.
Okay, Paul. So I think the glaring difference here would be convenience, cost, uh, selection. These are the three main factors that we discussed so far. And we've discussed, I think, the two very general and very accessible services that we have in Malaysia, the private setting as well as the public um, healthcare, in this case, mental health setting. But we also have other, perhaps fringe services available for the community out there. But these services perhaps are, for example, services provided by practitioners in training, or services provided to specific demographic in the population only. And maybe we could spend the last maybe 5-10 minutes discussing very briefly on these other options instead.
Okay. Sure.
So the alternative option for potential clients out there, at least for access of psychological assessments and therapy, will be services provided by trainee psychologists. So trainee psychologists are psychologists who are in training. They are undergoing at least a master's level education. And as part of that, they would have to undergo practicum training. So field experience, seeing clients while they are being supervised. And from my understanding, a practitioner in training will first have to provide a service in a university setting, which is something that you have provided as well. Could you tell me more about that? So how does a person access that service?
Usually, they could make an appointment through the website. Let's say the uni has a website or even a Facebook page, any means of contacting them. They could sign up online, or they could even make a call if they have a call. They have a number, and then probably they would have to wait a couple of days before they get assigned a trainee, a psychologist or a counselor in training. And then they would be able to access the services either in person at that particular university, or they could also do online teletherapy. So I think your next question is about cost, right?
So because these practitioners are in training, and arguably the level of experience and the level of service could potentially be different than the qualified practitioner, which I suppose is reflected in the cost to the client or the patient.
Yeah, that's right. So generally, some universities do provide service at zero cost. Yeah. Where I used to practice, there is a fee of 15 ringgit registration. And then after that, each session would be 30 ringgit. But the registration is a one-off. So I would say 30 ringgit, more or less similar to public hospitals. But I guess with university, there is a bit more flexibility because you don't need a referral letter, you don't need to arrange for the time, like every couple of months, there likely be more availability.
Yeah. So there's going to be more availability, but the downside to this would be that they are trainees. You had mentioned it being 30 ringgit. The university where I was from is about 45 to ringgit for the first session, 30 ringgit for the second session onwards. And it could also make sense that these universities provide services to their own students, perhaps free, or maybe with a very minimal charge.
Subsidized, yeah.
And I like to make that distinction between practitioners in training in a university setting versus them being in the field, in external settings, because they first must undergo what we call internal practicum. So that's their first time actually providing services, their first point of contact with a client, likely the first few times they are to ever interact and provide the services. But arguably, they are more experienced when they are in external practicum. So at places such as at People, where we do provide training services as well, these students have already accumulated by this time, 100, 200 contact hours with prior clients. So they are a little bit more experienced than when they are still in university setting. But nevertheless, the fees are pretty much about there. It's not going to cost more than 100 ringgit per consultation. Nevertheless, it's still equal, at par, or perhaps slightly more expensive than going to a public hospital.
Yeah, I would say at par. At par.
I suppose the compromise that potential clients would have to make would be arguably the level of service, the quality of service, because they are, rightfully so, they are still being supervised, and they have less experience than qualified practitioners. So this is, I suppose, the compromise that has to be made if they were to access trainee services, which maybe has the advantages of what the private setting could offer, the convenience and so on, but with the downside that you're not getting access to someone who is fully qualified and experienced.
Yeah.
This is with regards to trainee services that can be an option for someone when they are considering the private practitioners. At the same time, I think to highlight this to the audience back home, there are other service providers as well. These could come in the form of NGOs, where their main source of income compared to a private practice might not be from the fees. Rather, they may receive grants, donations, or they may hold fundraisers as part of actually receiving funds to maintain their operations. Oftentimes, the services that they provide are more targeted to specific populations. From my understanding, there are organizations in Malaysia that champion, for example, the well-being or welfare of refugees, or for orphan children, or for battered women.
Yeah.
So all these are very specific services for very specific populations, and there can be counseling or psychological or psychiatric services provided as part of their initiative as well. From my understanding, there can be religious organizations, churches, for example, or Buddhist organizations, or Muslim organizations that also employ or get services from mental health professionals as part of providing services to the community that they serve.
Yeah.
So for that reason as well, the fees will likely be free or maybe heavily subsidized as compared to meeting a private practitioner. But the downside being, if you're not part of that population that they serve, it's quite unlikely that they will provide the access to you. In the case of even, for example, religious organizations, you might be required to be a member of that particular religion. Or even if it's provided to you, it's something that you really have to go out of your way to look for lah. Compared to, searching on Google, I want to meet a psychologist today, and like all of these different private practice will already pop up, and then you make your choice just like ordering from a menu maybe.
Like the immediacy.
Yeah. So this one also similar to the public services. There's a few hoops that you have to go through. But with NGOs, the hoops that you have to go through in terms of researching and accessing the service, maybe there's going to be more. And it might be uncertain as well, depending on who you are and the kind of the kind of identities that you belong to that might be served by these different organizations.
Yeah.
So Paul, I think to wrap up our discussion today, the main point of our episode is really to provide information to our listeners on different options available. We have highlighted the few options that we have in Malaysia, advantages, disadvantages as well. But I think, to really wrap up our discussion today, if, let's say, one of our listeners is really thinking about getting mental health services, what will be some words of advice or for something that they should consider before they make that first step?
We've been basically talking about cost the whole session. So I am tempted to put that as the primary consideration. But there are also other factors such as urgency,
Mm.
how well are you able to cope? You
Mm.
know, if there's going to be a long period until you finally get help, you know, and I'm talking about not just the first point of contact, but continuity, you know, that sort of thing. So you also have to think about whether you're able to travel, go there frequently if you need continued care.
Mhm.
Yeah, and then comes the other smaller factors such as your comfort during the session, whether you want to be able to choose your therapist. So there's quite a few things like that.
Mm.
Yeah, but ultimately, if you're feeling really conflicted, you don't know how to pick, I would suggest just go for one, right, and try it out. So you can either go to a clinic kesehatan to try the first point of contact, and then, or if you're really urgent, you need help immediately, so you can seek out a private practitioner in that case. Yeah, but just give it a go.
Mm.
I would say that's my advice.
The most important thing is that you access services.
Mhm.
So that will be your advice. Of course, the reasons that you've mentioned are the things that we've covered today: the convenience, accessibility, the fees, and so on. These are very important factors to consider. In fact, a lot of our clients and inquiries also consider all of these factors in terms of making an informed choice. But the most important thing, what you're highlighting here, is that you should be giving it a go, regardless where you're getting it. Get it from a professional, and see where that takes you. The second piece of advice that I hear, perhaps is slotted in between, would be that consider also that it is going to take some time. It is not just one session. As much as you want to give it a try, give it a go, but consider that in terms of improving your mental health, it's not something that can be achieved just overnight. So with that in mind, that is something that perhaps keeps you more informed in terms of making your choices. You can commit to one first, but do consider that after that one step, likely there are several steps after that to follow.
Yeah, definitely. I think you summed it up really nicely. I was trying to make the point that don't get stuck because there's so many things to consider. Just take the first step, and then you can decide on the second step, the third step, and moving forward like that.
Yeah.
Yeah.
So that's making an informed choice, right? So I maybe access a service, wasn't a pleasant experience. That keeps me informed for me to make my next step. But nevertheless, what's really important is to really give it a go.
Mm-hmm.
Well, Pearl, I think we've reached the end of our time today, and I thought that we really discussed and provided quite good information to our listeners back home. Thank you for being a guest on the show.
Thank you for having me.
Thank you for tuning in to this episode of Be Kind to Your Mind. Be sure to catch us again on Spotify or YouTube every 2 weeks. If you're thinking of having mental health services from a private center, do consider us. See you in 2 weeks' time.